Dr. Ken Landau. Thanks for watching. Let's talk about Neurontin or Gabapentin. Very widely used medicine, consistently among the top 10 prescribed drugs in the United States. It first became available in 1993 as Neurontin, and then it became generic in 2004 as Gabapentin. It was originally prescribed as an add-on medicine for adults who had partial seizures, and in 2000 it was used for children with partial seizures. And then in 2004, it was used for post-herpetic neuralgia. Originally, it was manufactured by the Warner-Lambert division of Parke-Davis Pharmaceuticals. Later, Pfizer bought them. It had a rapid increase in the use during the latter part of the 1990s, but without any supporting medical documentation that the pill worked. So the FDA has certain approved indications that I just mentioned, but the drug was being used, misused, and abused more frequently than it was used correctly, and it was being used for recreational purposes, for treatment of hot flashes, for anxiety or bipolar disorder or mania or depression. It was used for migraine prevention and obsessive compulsive disorder and multiple sclerosis and alcoholism. It was used to assist in getting off of cigarettes, or people who had itchy skin with kidney disease, or people with essential tremor or low back pain or sciatica, or people who had insomnia. It was also used for children with attention deficit hyperactivity disorder, for the irritable bowel syndrome, for overactive bladder. And then it was used appropriately, so to speak, for post-herpetic neuralgia, but the studies that showed it was effective in post-herpetic neuralgia were only of moderate quality. They weren't top-notch, and they might not even be accurate. So when studies were done, the studies pretty consistently showed about a 50% reduction in pain. That's the minimum that you notice. So 50% reduction in pain, but only in 15% of the people who took the drug. And to get that benefit, people were often taking excessive quantities of the drug. So that basically means that if 15% of the people got 50% improvement, that means 85% of the people didn't even have noticeable improvement of their pain in studies that lasted anywhere from 4 to 12 weeks. But the pain can last for months or years if you have post-herpetic neuralgia. Well, if you're going to take the drug, you start off at one pill once a day. Then after a period of time, you go to 2 pills, take one every 12 hours. Then after a bit, you take 3 pills a day. Then you go up to a total dose of 600 milligrams every 8 hours. That would be the max you're supposed to take. And they have now an extended release form called release, that you only have to take 1 pill a day, but you start off at a low dosage, and then you increase it up to 1,800 milligrams a day. Now, it's not known to help any other pain condition. So if you have surgery, you have knee surgery and you have pain, abdominal surgery and you have pain, this is not the pill that you're going to take. If you happen to have a sensory neuropathy from HIV infection, or maybe you have the regional pain syndrome that we call reflex sympathetic dystrophy, well, it's not going to work. It doesn't work in even the neuropathic conditions that aren't either diabetic neuropathy or post-herpetic neuralgia. It doesn't seem to work in any of the relatives. And interestingly, all doses seem to give you pretty much about the same amount of relief, and it's just as effective but much less expensive than Lyrica. So some people have an impression it's a pain pill. As I said, it's not. Some people think it's just a general neuropathic pill. It is not. There's no reliable evidence for that. And even for epilepsy that it was approved for, it seems to work only in about 20% of the people. So in other words, 80% of the people who take it for epilepsy, the partial epilepsy, it doesn't even work. 10% of the people who take placebo get as much benefit. Well, there's no appreciable metabolism inside the body of the medicine. It's excreted unchanged in the urine. It's not bound to any proteins circulating in your bloodstream. The half-life is about 5 to 7 hours. That's why you have to take so many in the course of a day, unless you're going to take the very expensive slow-release form. And the good news, if there's any good news about the drug, is it doesn't change any other drug's metabolism. So you can take it with or without food. You can actually even break the pill in half, but if you break the pill in half, you better use it relatively quickly because it's shortly going to become ineffective. And interestingly, with this drug, the more you take, the less is bioavailable inside your system. So if you take a dose of 900 milligrams, 60% is going to be bioactive in your body. But if you take a dose of 2,400 milligrams or 3,600 milligrams or 4,800 milligrams, only a third of it is going to be effective inside your body. Pregnancy, not a good idea. Preclinical studies show that it can cause skeletal and visceral abnormalities, increased fetal death. It's passed in the mother's milk, so we don't think it's so safe for use by women who are breastfeeding. Used more in women than it is in men. It seems that it's used as frequently in people over age 60 as it is under age 60. There's some drug interactions that you have to be aware of. The drug interacts with other central nervous system depressants. So interestingly, if you take it, it is going to decrease the concentration of hydrocodone in your system. That's interesting, but it means that if you stop taking the gabapentin, then you're going to have an increase in the amount of hydrocodone in your system, and that might be sufficient to knock you off. That's a very dangerous situation. If you take it with morphine, morphine is going to increase the concentration of gabapentin in your system, and as you'll see, gabapentin has a significant number of side effects. So how does it work? It's a central nervous system depressant. It works similar to a chemical that you might have heard of, GABA, G-A-B-A, and it works on a variety of areas of the brain. It also probably interacts with a group of other receptors. It probably works on the NMDA receptor and maybe some of the inflammatory cytokines and protein kinase C. The side effects, that's what you have to worry about. A lot of side effects in taking gabapentin or Neurontin. Side effect of dizziness. Probably up to 30% of the people who take the drug, at least initially, are going to feel very dizzy. And remember, I said it's a central nervous system depressant, so 1 in 5 people are going to suffer from fatigue or sleepiness or drowsiness or gait abnormalities. Some of the people are going to retain water, so they're going to have swelling of hopefully just the feet, sometimes even the face. Some people develop tremor from taking the drug, or their eyes dart back and forth like that. Sometimes it can cause in men sexual dysfunction, erectile dysfunction, loss of libido. It causes the usual side effects: headache, nausea, vomiting, constipation, indigestion, diarrhea, dry mouth. It can actually cause some teeth problems because it interferes with saliva. It can cause some blurred vision and slurred speech. If you take it with the benzodiazepines or the opioids, or if you drink too much, it can really suppress your central nervous system, and then you could die. That's a problem. Side effects, especially in relatively young people, include hostility and agitation. It can increase the size of the male breast, not the female breast. It can cause liver abnormalities, jaundice, elevated liver function tests. It can cause high blood pressure and palpitations. And in older individuals, their kidney doesn't work as well. So more of it builds up inside the system, and as more of it builds up, then you become sleepy. So sleepiness is a significant problem in senior citizens especially. It can cause a variety of problems because it can cause you to be sleepy. You've got to be careful driving a car or operating heavy equipment. It can cause a hypersensitivity reaction, cause your tongue to swell, cause your blood pressure to fall, breathing abnormalities. And there's an interesting syndrome called DRESS. And DRESS stands for drug reaction with eosinophilia and systemic symptoms. And what that can do is cause inflammation all over. It can cause a fever, it can cause nausea, it can cause lymph nodes to be swollen, and it can cause inflammation in your heart, your liver, your kidneys, your muscles, your lungs. That's a major issue. And if you stop taking it suddenly and you had a history of seizures, well, it can cause you to have epileptic seizures, and it can cause increased incidence of suicide and suicidal behavior, and especially in children between the ages of 3 and 12, it can cause significant emotional lability and hostility and thought disorder and movement disorders. And in animals, it can cause a pancreatic acinar cell carcinoma. And in preclinical studies, it was shown to increase the risk of adenocarcinoma. It's one of the most widely prescribed substances, widely abused substances. The Centers for Disease Control says it's not an addictive drug, but because it's low cost and it's widely available and it's not a controlled substance, people are abusing this one like you can't believe. In 2012, there were 39 million prescriptions written for the drug. In 2016, that number had increased to over 64 million and continues to go up. Between 2011 and 2016, there was a 300-fold increase in the number of prescriptions written. Drug abuse in Appalachia has increased about 3,000% over the period of the past 10 years. It can potentiate the action of other central nervous system acting drugs, so it increases the high supposedly, although in people who take methamphetamine, it sort of makes them mellow. It's also used to cut heroin. Well, in abuse, it's known as Johnnies or Gabbies, and as a matter of fact, probably 50% of the people who abuse just opioids also abuse gabapentin. And if you abuse opioids and either muscle relaxants or benzodiazepines, 25% of the people abuse this one too. In Ohio, there were 9 million more prescriptions for gabapentin than there were for oxycodone, and it's the most widely abused and diverted illicit drug in the U.S. prison system. So there's a lot of abuse going on in this. If you look at the general population, somewhere 1-2% of the people abuse the drug. If you look at the opioid users, well, probably more than 60% abuse the drug. Well, it's very frequently used in combination with cannabis and with alcohol and with the SSRIs and with GABA or the GHB. First reported case in the medical literature came out in 2007 in a woman who was 67 years old. She was taking far in excess of the recommended dose. She was taking 7,200 milligrams a day. She suddenly stopped the drug. She had withdrawal symptoms. She had trembling, and she had sweating, and she had excitation, and she turned ashen. Question is, why do people abuse the drug? People abuse the drug because it increases their sociability, it increases their euphoria, they get a marijuana-like high, it causes relaxation, a sense of calm and mellow, but in some people it causes what's known as a zombie-like effect. Now, if you stop taking the drug, you got to stop taking the drug slowly. If you suddenly discontinue it, you will have withdrawal symptoms. They can range from anxiety and insomnia and nausea and vomiting and headache. You can be sensitive to the light. You can be confused and disoriented. You can have seizures and chest pain. You can have sweating and flu-like symptoms. Now, starting in the mid-late 1990s, the drug was marketed by the drug company for in excess of 12 non-approved conditions. So that the FDA hadn't approved, their studies hadn't shown that it was effective, and the studies that were done were small studies that were funded by the company, and they selected the ones that they wanted to publish, and the ones that showed it wasn't any good, they didn't publish. Well, as a result of this kind of nonsense and the shenanigans going on, the company paid more than $400 million in fines, and then they were also sued by the Kaiser Foundation, had to pay them about $150 million because they were being promoted. They promoted the drug, the company, for bipolar disorder, migraine, headache prevention, without any kind of indications. And actually, a lot of the internal documents regarding the drug came out because of lawsuits and what's called the discovery. And it was called in internal emails, actually, by the executive medical director. I'm not making this up. The executive medical director said it's the snake oil of the 20th century, and the former vice president of neuroscience said it had negligible effect on treating depression. So actually, there was a study that was published in 2009 in the New England Journal of Medicine, highly respected. And what they did, was because of all of the lawsuits. They had some internal documents of the company, and they looked at some studies. They looked at the studies that were done. They looked at the protocol that was used, and then they looked at the protocols that were published, and they found a lot of differences. What that means is you change the result to show whatever you want, and that's not the way science is performed. That causes significant problems. Well, there's some extended release forms of gabapentin. There's release and there's Horizon. Now, both of them are phenomenally expensive, and as a matter of fact, the insurance companies tend not to want to cover these things. They both came out in 2011. The release was for post-herpetic neuralgia. The Horizon is a prodrug, and it's used for people who have restless leg syndrome that's moderate to severe in nature, or for post-herpetic neuralgia. Well, how much is all this going to cost you is the question. If you go to Costco and you get a month's supply of generic gabapentin, it's going to cost you 15 bucks, cash. If you go to Walgreens, it's going to cost you 70 bucks, and if you go to CVS, they'll charge you $80 cash. On the other hand, if you go to GoodRx and you get a coupon, it's going to cost you less than $20 cash, with or without insurance. Now, if you're silly enough to want to take the brand name of the drug, if you want to take the Neurontin, you can go and buy it, but it's going to cost you $600 cash, and it's not any different than the generic drugs, at least as far as effect is concerned. And as I said, the Horizon and the other drug, the release, horribly expensive. So you see all these ads for Lyrica, and remember, Lyrica and gabapentin or Neurontin basically are the same family. They do the same thing. They work the same way, basically, and they have the same effects. And unfortunately, neither of them work very well. If you want to know more about Lyrica, watch my discussion on the web about that one. But as far as gabapentin is concerned, it's prescribed too often. It's prescribed for indications that are inappropriate. It doesn't seem to work very well, has a lot of side effects. So you got to be careful with this one. Unfortunately, it seems like we have another drug that's abused more than used appropriately. It's a shame. I'm Dr. Ken Landau, and thank you for watching. Bye-bye.